Following a diagnosis of schizophrenia, the physician determines a treatment. This short film gives you some information about the general treatment and medication used in treating schizophrenia, along with some important information about possible medication side effects. This will help explain why it's important to find the right medication to suit the individual patient. Only a physician can recommend which treatment is the most suitable. The physician assesses the patient, his level of impairment, and his personal and social functioning, and then discusses the proposed treatment with the patient and the family. Usually, treatment will be a combination of medication and psychosocial therapy, also known as talking therapy. Medication is needed to alleviate the symptoms. Talking therapies can help the patient to control their thinking and their behavior, which in turn should make it easier to cope with the daily demands of life, in hospital, at home, at work, and in the community. The medication used to treat schizophrenia is called antipsychotic medication. A doctor will recommend the most appropriate antipsychotic medication for an individual patient. Along with their beneficial effects, like all medications, antipsychotic medication can also cause unwanted side effects. Taking older medicine can induce both short and long-term side effects. Typical short-term side effects are extrapyramidal symptoms, or unpleasant movement disorders such as shaking, fidgeting, muscle spasms, and stiffness. A long-term side effect particularly associated with older medication is tardive dyskinesia, or the appearance of involuntary movements, mostly of the mouth and face. To counter these side effects, additional medication may be required. With newer medication, called atypical antipsychotics, the risk of such side effects is lower. However, new medication can be associated with weight gain and a loss of sexual drive. On the other hand, atypical antipsychotics may improve quality of life and general well-being of the patient. To help patients who have difficulties with regular medication, your physician or a nurse can administer long-acting injectable medication, only once every few weeks. Since it is of extreme importance to not interrupt medication, long-acting medication can be a big help. Patients don't have to remember to take their medicine every day. Now you know more about the possible treatments for schizophrenia and the medication, as well as the possible side effects of antipsychotic medication. If a patient experiences medication side effects, it's important to see a physician to discuss changing the medication or decreasing the dosage. Even if all goes well, the patient should continue to visit the physician regularly, so that the condition can be monitored regularly and the patient can receive ongoing support and information.
Meet Mark. Mark has schizophrenia. Lately, Mark hasn't been taking his medication. Sometimes Mark feels okay without his meds. But the effects aren't all positive. Anxiety can come between Mark and his friends. Episodes can be disorientating and confusing. In no time at all, Mark's life can spiral out of control. Living with schizophrenia and the threat of relapse is unpredictable for patients and carers. Take back control. Go to www.schizophrenia247.com to find out more about your options.
Now, when is the best time to call your healthcare provider? Now, you have to call the healthcare provider if the following happens. Voices are telling you to hurt yourself or others. You feel the urge to hurt yourself or others. You are feeling hopeless and overwhelmed. And you are also seeing things that aren't really there, as well as you feel like you cannot leave the house and you are unable to care for yourself.
Who can say where the road goes, where the day flows? Only time. And who can say